Доброго дня, шановні.
Good afternoon, dear guests online and the audience. The Ukraine Crisis Media Center starts its work, and we start our online press conference. Effective governance of the health care facilities network and consolidation and continuity of national and international programs. And I give the floor to our moderator, Yevhen Prylypko. Good afternoon, dear colleagues. At the start of our meeting, I would like to focus on the main idea in order to understand what we should do in our initiative. I will launch my presentation. Please check if everything is okay.
Ключова теза полягає.
The key topic is that administrative reform and healthcare reform, they have the same principle: to take into account the needs of people and to provide quality and safe services. At the same time, there are some contradictory forces. Healthcare reform needs decentralization and concentration of medical services. So overall needs of healthcare may be resolved with the use of less complicated services, less costs, and these are services of the level of community. This is about decentralization. More specialized medical assistance requires improvement of medical equipment, concentration of resources in one big hospital that provides the flow of the patient. And as of now, part of hospitals in small cities, they are in the systemic shock, and they may be liquidated, or there are some problems in management, shortage of personnel, and some delays in organizational processes, and problems with development of healthcare. These hospitals need our proper attention in order to provide properly medical help based on the needs of the people. This is interrelated with different issues. In the decentralization conditions, this needs proper resolution. There should be proper consolidation of efforts of local and international projects. So You Lead Europe helps us to transform the system of healthcare in Ukraine at regional, local level to form integrated system of healthcare institution that support maximum benefits for patients and providers of medical services. And of course, this is done also at the level of the bodies of local power. At the start of our meeting, I would like to give the floor to head of multi-level governance unit of ULEAD Europe, Sören. But at the start of our meeting, the information was provided to me that he won't be able to join us today. Nevertheless, I would like to thank ULEAD Europe for their support of our program, and I would like to give the floor in the framework of decentralization. Important is communication and work with the Ministry of Healthcare of Ukraine. This is really important now when reforms and changes are planned concerning types of hospitals that belong to communities. So clear sectoral communication is really important. And now I would like to give the floor to Deputy Minister of Healthcare, to Oleksii Yaremenko, who will outline the policy of the ministry in conditions of decentralization. So I stop my broadcasting and I give the floor to Oleksii. Thank you, Evgeny. Thank you for this right message that you provided to us. I would like to start my presentation. Yes, we may see your presentation. Thank you. First of all, I would like to welcome and greet everyone with the start of this important project concerning the effective governance of the healthcare facilities network, and we thank you, Lead, for this initiative, and we hope that all the information in the framework of this project will be useful for healthcare institutions and communities and for local government officials. I would like to focus on several key priorities for the next year, connected with decentralization and with governance at the local level. At the same time, the Ministry of Healthcare is working on development of the national strategy of healthcare reform till 2030, and we plan to adopt it in January next year. And it will broadly outline all the key areas. Today, I would like to focus on two important priorities. The first one, what should happen the next year? First, we should provide good salary to medical personnel. And second, we should increase competitiveness of healthcare institutions. Let's remind ourselves that decentralization brought significant changes into the system of healthcare, and the communities got significant responsibilities in building this network of healthcare institutions. And the majority of hospitals were provided to local level, to cities, to communities, and the budget proceeds provided, and they remain. And we see significant need in cooperation between the communities to build this facilities, and I will go into detail about this. What should we expect from communities and from the owners of the hospitals? I would like to say that for the next year, we will increase the process for 34 billion hryvnias, and this is a significant increase of the budget for healthcare. And the priority for 2022, this is provision of good salaries to medical workers. Minimum for doctors, this should be 20,000 hryvnias, and for nurses, 13,500. And proper changes to legislation were registered in the Verkhovna Rada. Until the end of the year, we hope the Cabinet of Ministers will provide proper resolution and will establish this salary in healthcare institutions in the amount that correspond 20,000 and 13,500. This will be the minimum salary for medical workers. Also, we provide budget modeling for the healthcare institutions, and we see that the majority of institutions, they are capable to provide new level of payment. 73% of primary medical care and 81% of specialized medical facilities. So here there is a question why others are not capable. What prevents some local facilities, healthcare institutions, to provide this? Often, these questions are in the sphere of management, concerning management of this healthcare institution and their cooperation with the owner. So what ways we see to resolve this? First, to reconsider the budget, to develop budget plans for to develop the system, to connect polyclinics to specialized institutions, or to create powerful institutions of primary health care from these polyclinics, based on these polyclinics. And also we should provide reorganization and to establish proper connections to provide proper healthcare services in the hospital districts, and also to provide new medical technologies and to provide proper facilities in hospitals and to provide proper package of medical guarantees. It should be introduced, and also we need to reconsider the format of provision of services to population, to introduce new technologies of healthcare provision, and also we should build the routes for the patients through this network. So the task of the regions are to create this hospital plans and to identify the place for each medical institution in this hospital plan. So starting next year, we will create the new typology of hospitals, above cluster institutions, cluster institutions or facilities that will cover population and general hospitals that should provide quality specialized medical assistance at the local level, and transitional healthcare institutions that should be developed, and the budget should be provided for them, or they should become powerful institution of primary healthcare. So I would like also to focus on one more thing. Decentralization brought significant responsibility of the owners of healthcare institutions, and communities, they are not capable to be on their own. They cannot develop hospitals on their own. That's why we really motivate the communities to cooperate among themselves. For this, we need to build and develop proper plans to develop the points of provision of medical assistance, ambulatory services, and to also develop the personnel, to create supervisory boards, to involve representatives of communities and other stakeholders, also to establish the proper level of participation of the members of community in the development of hospitals, and also to improve services, medical services to population, those who have the participation in this process. And we hope that 2022, this will be the year when our medical personnel will get proper salary, and each hospital will be able to find its own place in the network of healthcare. And this will lead to stabilization in order that patients be able to get the highest quality of healthcare. Thank you. So I stop my presentation. Yevgeny. Thank you very much, Oleksii, for these clear messages and for this positive mood. Consolidating efforts and proper communication, they provide proper basis to overcome challenges. And we would like to speak not only about this, but also about the hospitals in the rural areas in different countries. And we have our guests here to share international experience. And we give the floor to Loraine Hawkins, WHO consultant, governor of the Healthcare Foundation, and she will speak about decentralization reform and other issues concerning Ukraine. Thank you. Thank you. The floor is yours.
Thank you very much. Let me share screen. While I do that, let me also begin. Because I'm struggling here with my doing two things at once. Right, here we are. Now I'll try to share screen. There, thank you. First, thank you very much for your introduction. What I would like to focus on today are some of the challenges that arise because Ukraine has undertaken two very ambitious long-term reforms affecting the health sector simultaneously in the last 5 years. It's very ambitious, and those reforms are new. And as you expect with these processes, many of the challenges to really get the benefit from these reforms will take some time and quite a lot of work. So the decentralization reforms have given local self-governments responsibility for primary and secondary care. And with the potential to make healthcare more responsive and accountable to local citizens and patients. At the same time, health financing reform re-centralized health financing. So the program of medical guarantees is now managed nationally by National Health Services Ukraine. And that gives the government a mechanism for influencing local health services to increase equity, access, and quality. But what are the challenges?
Loraine, excuse me. Loraine, excuse me. Are you changing the sliders? Because we
Yes, I'm changing the slide. Let me shift to the first slide.
Okay, now it's all right. What's on the first?
Okay. So what are some of the challenges created? First of all, for small, poorer gramada, health services are complex to manage, very complex.
Я перепрошую, представники ЮЛІТ.
Даже невозможно в таком темпе. О, все, есть он, да?
Secondly, the challenge that you've already been discussing in this workshop, the challenge of how to optimize the local health service delivery network and improve its management, is more complex because you now have more local governments involved in owning and managing health facilities.
Так, можна перекладати, так? Угу. Отже, звичайно, невеликим громадам дуже складно, скажімо так, надавати медичні послуги на місцях, і, звичайно, існує виклик оптимізації мережі медичних закладів, оскільки більше органів місцевого самоврядування залучено у цей процес.
And decentralization experts sometimes question why the government re-centralised financing at the same time as decentralising service delivery. But what I would like to speak about is the potential to use this system to best combine the advantages of centralised roles with the advantages of local government knowledge and accountability for service delivery.
Отже, деякі експерти децентралізації задаються питанням, чому дійсно система охорони здоров'я підлягає централізації, адже у нас зараз проходять здебільшого децентралізаційні процеси. Але хочу наголосити на тому, що потрібно комбінувати переваги як одного підходу, так і іншого, і скажімо так, поєднувати централізацію зі знаннями органів місцевого самоврядування.
So, at the moment, although the NHSU pools most of the funds for national, and the National Health Service Ukraine pools most of the funds for the operating costs of healthcare, local governments are still responsible for capital expenditure and tariffs, and for meeting the losses of health facilities.
Отже, хоча наразі Національна служба охорони здоров'я України відповідальна за більшу частину фінансування системи охорони здоров'я і за операційні витрати, органи місцевого самоврядування все ж таки несуть відповідальність за капітальні видатки та за збитки лікарень, які вони несуть.
Poorer local governments, small gramada, can't afford to invest to meet all of the service standards in their new healthcare networks, while richer local governments potentially could invest in fragmented or duplicative capacity.
Дійсно, якщо ми говоримо про невеликі громади, то вони стикаються з викликами відповідання для того, щоб відповідати стандартам надання медичних послуг. І трошки більші громади мають більший потенціал забезпечення фрагментарного надання послуг чи дублювання повноважень.
Private care providers are also dissatisfied with this situation because NHSU, National Health Service Ukraine, tariffs do not cover the full costs of healthcare like utilities and capital, and that makes it difficult for private providers to compete with local government facilities.
Отже, надавачі медичних послуг також не зовсім задоволені, оскільки фінансування Національної служби охорони здоров'я не покриває видатки на комунальні послуги, і тому лікарням, скажімо так, важко конкурувати один з одним.
And I think at a more kind of conceptual or theoretical level, the fact that we now have a budget code which gives overlapping responsibility, it allows local governments to supplement central government financing for health. We have divided responsibility, and we know that divided responsibility weakens accountability.
Ми знаємо, що відповідно з бюджетним кодексом дозволено органам місцевого самоврядування дозволяється також додатково фінансувати заклади охорони здоров'я з місцевих бюджетів, але ми розуміємо, що ця розподілена відповідальність, вона послаблює підзвітність.
And finally, a very practical problem is that health facilities don't know what their contract with NHS Ukraine will be until the end of the year every year. So it's very difficult for facilities to plan their budgets even for 1 year, let alone for the medium term. It's very difficult to know how to make a health facility financially sustainable when contracting is so short term.
Але з практичної точки зору можна сказати, що органи місцевого самоврядування не знають до самого кінця року, які контракти буде укладено Національною службою охорони здоров'я, і тому їм дуже важко спланувати свій бюджет не тільки на наступний рік, але й на довгий термін. І таким чином вони не можуть забезпечити фінансову стійкість, стабільність своїх медичних закладів.
There are some steps that could be taken, and this slide presents some recommendations for actions that could be taken to mitigate these problems.
Отже, на цьому слайді представлено деякі поради, рекомендації, які допоможуть уникнути чи полегшити вирішення цих проблем.
First of all, government could consider shifting responsibility for utilities costs and all of the operational costs of the program of medical guarantees to the NHSU, to National Health Service Ukraine.
По-перше, можливо розглянути перекладення відповідальності за витрати на комунальні послуги на бюджет Національної служби здоров'я України і таким чином частково перекласти операційні витрати програми медичних гарантій.
Secondly, we suggest the central government could consider a conditional grants program for local governments to support capital investment in the agreed capable facilities network plan and upgrading quality standards in hospitals and primary care facilities.
Також центральний уряд може розглянути можливість надання умовних грантів для органів місцевого самоврядування для того, щоб спрямувати інвестиції у погоджені спроможні мережі медичних закладів і також інвестувати в підвищення стандартів якості лікарень та закладів первинної медичної допомоги.
And of course, this program could be designed to give greater assistance to poorer local governments.
І, звичайно, ця програма допоможе біднішим громадам.
Next, we think the National Health Service of Ukraine needs to be empowered to contract selectively with the hospitals in the agreed capable network.
Також Національна служба здоров'я повинна мати можливість вибірково укладати контракти з лікарнями та погодженою мережею, спроможною мережею медичних закладів.
This would make those providers more financially sustainable.
Це забезпечить більшу фінансову стабільність цих надавачів медичних послуг.
But then we also suggest that National Health Service Ukraine should develop multi-year contracts, not just annual contracts.
Ми також вважаємо, що Національній службі здоров'я варто укладати багаторічні контракти.
And we think that local governments and NHSU should develop a local coordination mechanism so that the two parties can coordinate transition support for loss-making healthcare facilities during the time that it takes to implement the Capable Facilities Network Plan.
Ми також вважаємо, що органам місцевого самоврядування та Національній службі здоров'я України варто розробити механізми координації для підтримки перехідного періоду збиткових медичних закладів в процесі реалізації плану мережі закладів. Все, вибачте. Sorry, you can go on.
Thank you. I'd now like to turn to the subject of health service delivery, which is now the responsibility of gromadas and cities, as well as oblasts.
Зараз я хочу перейти до питання надання медичних послуг, яке зараз знаходиться в сфері компетенції органів місцевого самоврядування.
And I think everybody is conference understands the problem of fragmentation of the healthcare network across many local governments, and the problem that there's lots of overlapping responsibility because patients from one gромada will often use services in a neighbouring gромada or oblast services.
Я думаю, що всі присутні тут розуміють проблему фрагментації надання послуг, а також дублювання повноважень, оскільки пацієнти використовують послуги, наприклад, з обласних лікарень чи інших районних лікарень.
The additional challenge for Ukraine is that Gromada, many of them are quite small, but the recommended catchment population for an efficient, modern secondary care hospital is to have a population catchment of around 150,000 to 200,000 people, or even more, at least in urbanized areas.
Додатковим викликом для України є те, що у нас багато малих громад, а рекомендована кількість населення для закладів спеціалізованої медичної допомоги становить 150 тисяч, 200 тисяч для більш урбанізованих районів.
And for the smallest gромада, they may even lack enough economies of scale and expertise to develop their primary care services. Because currently, almost 20% of Gramada do not have a primary healthcare centre that offers the full range of primary care functions.
Невеликим громадам не вистачає можливості економити на масштабі чи досвіду для розвитку системи первинної медичної допомоги, і наразі майже 20% громад не мають центрів первинної медично-санітарної допомоги.
Ukraine has already recognized that cooperation between local self-governments is needed for not optimizing the facilities network and has created hospital districts.
Але в Україні вже зрозуміли, що потрібна співпраця органів місцевого самоврядування для розбудови мережі медичних закладів, і вже створено госпітальні округи з цією метою.
For those hospital districts which are organised in each oblast, their decision making is voluntary. The hospital district and the oblast do not have the authority to compel local governments to cooperate with their decisions.
Але питання в тому, що госпітальні округи є добровільними, і вони не можуть змусити органи місцевого самоврядування співпрацювати. Тобто вони не є підзвітними населенню.
The additional challenge is that oblasts are not self-government, fully self-governing. And so if we want to take advantage of the accountability of local self-governments, the problem is that an oblast-based hospital district doesn't automatically have that kind of accountability.
Але проблема в тому, що обласному рівні не вистачає місцевого самоврядування, скажімо так, і їм важко, обласним лікарням важко досягти певного рівня підзвітності.
And finally, interterritorial cooperation is also needed to coordinate primary health care, both for those 20% of Gramada that do not have centres, but also for broadening the role of primary care and integrating or coordinating care between primary care and hospitals.
Але варто зазначити, що міжтериторіальна співпраця також необхідна для координації розвитку системи медичної допомоги, і не тільки тим 20% громад, в яких немає цих центрів, але і загалом збільшити роль первинної медичної допомоги.
So what are the recommendations we would suggest to address these issues in healthcare delivery?
Отже, на наступному слайді представлено рекомендації, які ми пропонуємо для вирішення проблем надання медичних послуг.
And first of all, the hospital district development plans or capable facilities network plans and the hospital districts that created them must become really practically operational.
По-перше, плани розвитку госпітальних округів та самі госпітальні округи мають стати практичними та функціональними.
And that takes resources, shared resources, but we suggest that conditional grants from central government can help the districts both to do their work and to create incentives to make some of the difficult decisions that are needed.
Звісно, це потребує спільних ресурсів, але ми також пропонуємо центральній владі видавати умовні гранти, які допоможуть громадам приймати складні рішення і виконувати свою роботу.
But there's a need for the hospital districts to develop mechanisms for consulting local populations and building constituencies for change among local self-governments so as to build legitimacy for some of the difficult choices that will need to be made on hospital optimization.
Вони також повинні розробити механізми консультацій з місцевим населенням та формування округів серед органів місцевого самоврядування для забезпечення легітимності важких рішень, що стосуються оптимізації лікарень.
But at the same time, hospital districts do need decision rules to prevent a small minority of stakeholders from blocking decisions that really are needed, but which are opposed by small numbers of citizens or stakeholders.
Але водночас госпітальні округи також повинні мати можливість приймати рішення, аби запобігти блокуванню певних рішень невеликими групами зацікавлених сторін.
And a number of countries have found that it's a useful mechanism is to merge smaller facilities that need to be optimized into a larger provider group or network with its own legal structure and its own governance structure.
Отже, багато країн знаходять корисним механізм об'єднання невеликих лікарень у більші лікарні, які мають свою юридичну структуру.
We also recommend that inter-territorial cooperation bodies need to be established to coordinate primary care and integrated care, and though on a smaller territorial footprint than the hospital district.
Але ми також вважаємо необхідним створення органів міжтериторіального співробітництва для координації розвитку первинної, а також інтегрованої допомоги на меншому рівні, ніж госпітальні округи.
But I mean, our final recommendation relates to the fact that local healthcare facilities are now autonomous. So for local governments to do all these things, they need to develop governance structures, for example, supervisory boards, and the related roles and rules and reporting structures over the autonomous healthcare facilities or over the networks or groups of healthcare facilities.
Але зважаючи на те, що ми маємо наразі багато автономних закладів охорони здоров'я, медичних закладів, органам місцевого самоврядування також потрібно розробити певні структури управління, наприклад, наглядові ради і певні структури звітування для цих окремих лікарень чи їх мереж.
So thank you very much indeed for giving me this opportunity to share these thoughts from our WHO work on decentralization. Best wishes for your meeting.
Отже, щиро дякую за можливість представити наші думки з боку ВОЗ. Дякую і сподіваюся на зустріч на наступних таких конференціях.
Дякую, Лорейн, за
Thank you, Loraine, for your expertise. The WHO is continuously supporting our initiatives, and thank you for the interest shown to our reform activities. Thank you. I would like to continue. Of course, our press conference would not be sound and reliable without invitation and intervention to Mr. Ihor Hnatusha, who represents the Association of Amalgamated Territorial Communities responsible for the healthcare. Ihor, I'm happy to welcome you at this conference. The floor is yours. Can you hear me? Dear colleagues, the time of our conference is finite and limited, and I cannot see that Mr. Hnatusha is connected. Perhaps we should continue. Ihor, just a moment. He is almost connected. Ihor, I've introduced you. The floor is yours. Please unmute. Good morning, dear friends. I'm happy to see you. I'm happy to hear you. I represent the National Association of the Territorial Communities. I believe that the reform of primary healthcare services is needed. Very much needed, and it is successfully launched, but even more we need the secondary level of services reform. As of now, when people need secondary level health services, the mayors of cities have to get united in the effort to deliver the services and to provide good access to them. That's why we believe that major task for the 2022 is to launch the comprehensive initiative which will facilitate this process. And this process would include very new tasks, the tasks which are new for the local authorities. Today we feel ourselves that in the healthcare area we are almost fighting at the front line, because we find ourselves in a situation of the pandemic, in a situation of the fourth COVID-19 wave, and at the same time we are in the midst of reform, and we hope that we will coordinate the measures, bring together our colleagues. Maybe this would allow us to start implementation of the pilot projects, and eventually having implemented successfully the pilot projects, we will introduce this best practice from the pilot projects in all the local communities. Thank you, Igor. I believe that only coordinated joint effort would allow us to carry out good services with the participation and contribution from all the stakeholders, from local authorities, from service deliverers, etc. I believe that very soon we will start a series of online conferences where all the communities during the first 5 workshops will receive full information about this new initiative, irrespectively whether these local communities would become the spots of pilot projects or not. I also would recommend to invite the regional healthcare authorities as stakeholders of those pilot projects, because it is extremely important to coordinate the effort at the local level. And by the way, in many places there is lack of qualification among these public healthcare workers in the local governments, local self-governments. They drastically require upgrading, they require more experience, and I would recommend you to invite them. Igor, that is what we intend to do. As soon as we select pilot communities where the pilot projects should be implemented, we will sign memoranda on cooperation between the project and local governments about their close participation and coordination, because for us it is of course important to understand the level of clinics and hospitals at the regional level, which is well known to the local authorities. And of course, we will require support from the local healthcare units and local medical care government units. Now I would like to give the floor to the leader of the unit of multi-level management system of the ULEAD program, and I am sharing my screen now. So about the project, dear friends, let us take the level of communities. The community members have the right to all spectrum of medical services which are guaranteed by the state, and but the healthcare institutions which are located in the local community, they are incapable to provide multiple healthcare services, at least some of them. And this brings us to understanding of the following important thing, that that local healthcare institution is not a separate unit. It is the unit in closely connected system among the whole nation, and its activity should be seen comprehensively as a systemic unit among the system of the healthcare institutions in the region. And it is important to understand what specific healthcare services could be provided by this very hospital or clinic. What could be done by the local community to allow its members the access to other specific medical services and secondary medical consultations of medical specialists in other communities, etc. Thus, we understand that we need new medical healthcare system and new format of medical institutions. Of course, we will offer some basic specific services for small hospitals. For example, outpatient clinics, which requires transformation of hospitals which cover between 5 and 40,000 of a population. These hospitals have to rethink the traditional models of the services provided based on the specialization of each unit. We have narrow specialized hospitals which amount between 40 and 60% of the entire hospital network, and they as of now do not understand what responsibilities are delegated to them now. But actually, this is not typically Ukrainian problem. On this slide, you see the rural hospital transformation models. This is the document dated September 2020 in the USA. From 2010 in the USA, more than 130 rural hospitals were closed, and now more than 453 rural healthcare institutions will be closed soon. The communities also are endangered to stay without medical services and jobs. Let us look at other countries, at the closures of hospitals. Unfortunately, closures of hospitals quite seldom is accompanied with the strengthening capacity of bigger hospitals, and all the negative consequences happen after closure of hospitals in small cities and towns, and this puts additional risks on the patients and their families. That's why we need to support good policies, financing schemes which bring medical services closer to people. That is why small hospitals have to step back from the concept of specialized units in the clinic or hospital and create multidisciplinary medical teams with multiple experiences. All the negative consequences of the hospital closures and putting the risk on the patients and their families should be mitigated at the local level due to better weighted decisions. That's why we try to learn the lessons from those countries which are closer to us, and the lesson that they learned in the transformation of hospitals. For example, Lithuania. Many small hospitals in rural areas, they are facing the issue of closures. For example, this is my native village in Cherkasy region, and instead of 4.7 million, it will get only 150,000 hryvnia. So the closure of the hospital is inevitable, but whether this will strengthen the access to Medicare for local residents, for small and medium-sized rural hospitals, the expenses could be split into three categories. The fixed cost per one manipulation, which are higher than the cost of the same basic medical services in bigger hospitals. Then the quality of services and the level of assistance are much lower due to decentralization, but nevertheless, some departments like surgery departments and smaller hospitals, they are able to provide good quality services, especially to people of aged people. Systemic instability and uncertainty quite often result in the organizational paralysis of many rural hospitals. Now let us look at the projects. At the project itself, we have 2 stages, 5 blocks, and 8 months for the project implementation. The first stage is of more analytical nature from December 2021 to March 2022. The first component of this stage is to assess the needs in medical services in pilot communities. That is, we have to look at the need, but not only from the statistics, but also look at the prospective community development for the next 5-10 years. The next, to assess the financial risks for each medical institution separately. We have to predict the budgets needed for the proper functioning of these medical institutions in each community, in line with the newly established model for medical services. Then we have to check the real the actual expenses of each medical institution and how much is needed for the development. And at this stage, as an intermediary deliverable, we would understand what is covered from the local communities and what is covered at the regional level from the neighboring communities. we predict that 90% of communities would not get the budget compensation for the coverage of their small rural hospitals and clinics. Of course, some financial resources are available, and some specific items to which those allocations could be spent, they will be clearly indicated. Now, at this stage in small medical institutions, we expect that they will change their functions. This process should be well coordinated. In some medical institutions, we have cut down the volume of medical services on the one hand, but on the other hand, to prevent negative access to the healthcare services. Having analyzed the local communities, we will see the gap, the structural gap, financial gap between the needs and the available resources. Part of communities currently try to cover this gap even now, not clearly understanding what should be covered, how much should be allocated, and for how long period of time. After this stage, we will start our second phase, the investment projects for healthcare services, which will decrease the cost on services and increase the efficiency. We will set new models for the healthcare institutions development for the next 7-10 years. Component number 5, we will offer local programs for support, pharmaceutical insurance, voluntary or from the local budgets, and from the budgets of the major enterprises in this community. Now, intermunicipal cooperation about joint financing of the offered budgetary programs, understandable for each community. All these components should be based on the consolidation and collection of data. That is a database about patients, the profile, routes of patients, patient routes, etc. This will get mentor support from the monitoring panel, introduction of the informational healthcare systems, and ratings of healthcare institutions. It is important that this process would become transparent, planning, manageable, which would allow gradually increase the cost efficiency of medical institutions. We all expect that the tariffs on medical services will gradually grow, and the national expenses on the healthcare system would grow. Having all that, we will start strategic planning and start writing investment projects. I would like to emphasize that this work is related to the primary medical services and to the secondary medical services, which will remain at the level of local communities. About the project deliverables, or better to say the issues which we expect to resolve in the result of the project. How to manage the healthcare network, how to what medical types of assistance should exist, what should be done to make the healthcare services accessible for the community members, what should be done to strengthen the quality and of medical services, how can we modernize the obsolete infrastructure, why we need cooperation with other communities, what should be done to explain the system to members of the communities, and how the results of this work coincide with the satisfy the expectations of the community members. What the team is. When I say team, this includes not only the experts and the project team. This also means the community, medical institutions, then all the leaders, financial experts, from local self-governments, which are neighboring to the healthcare services, who keep statistic records, etc. All those people whose responsibility is to ensure access to healthcare services. Now the experts. Today I will introduce only some experts, but in reality this whole bulk of issues requires more than 12 external consultants. Today, well, I'll introduce only some of them, and you will pose your questions. Mr. Vidmantas Eigelis, international expert on the medical system, organization, etc. Serhiy Dyachenko, project expert on financial risks evaluation and the introduction of the regional healthcare coordination system. Olena Reshetnyak, expert in investment planning. Svetlana Sukhavy, analyst on healthcare expenses. Alexander Shapoval, development and implementation of the local community financial programs. Oleksii Bezhevets, investment programs and PPP. Volodymyr Revchuk, municipal coordination and regional healthcare systems. And you understand that this big team should be coordinated and brought together by international expert Ninel Kadyrova. We have there's a small team of experts which looks small, but actually it is bigger. And also Svetlana Bobenchikova, and I'm Yevhen Prylypko, director of the project. Now this about the source. The project idea raised back in 2019. Keeping in mind that decentralization processes in Ukraine stirred up local communities and pointed them on the direction of healthcare services, we decided to launch this project. But we capitalized on the previous experience from ULEAD, previous ULEAD project devoted to which developed a manual about decentralization and healthcare services in decentralized communities. If you had an opportunity to review that manual, perhaps you already know that actually many aspects, theoretical aspects upon which we base our assumptions are from that manual. The next is manual from the WHO about healthcare in local communities. Also, we take into account the project about financial expenditures of the healthcare institution, which was carried out between 2012 and 2018. Then the next is about a manual about hospital clusters. Then pilot project in Poltava region about implementation of state guarantees in healthcare services. This pilot project produced useful results. In 2020, Rural Hospital Transformation Models project in the US also produced good experience, recommended minimum standards for small rural hospitals in Australia, and much more information. Our international experts will summarize all that information and provide their recommendations. Now the next steps on the project framework, we have to present the components of the project. We will hold 4 online conferences where the participants will be able to contact the experts, ask questions, learn how to join the project for those regions which won't be recognized at the pilot. You see the dates and timing of the online conferences. And in each 4 regions which were selected for the pilot projects, we invite all the communities and encourage them to participate. You will have all the opportunities to join the online conferences. In case of any issues in connection in getting invitation to join the online conference, please ask your questions to our project assistants in UCMC website and on all the social media sites where you are able to watch this event. You will get the useful links you may go to this integrated platform, and having registered on it, you further on will be invited to participate in more than 50 events which we plan to hold. It's not just a registration to the event. And this is actually in virtual environment where within 8 months you will be able to communicate with experts. Actually, this is a kind of social network. On your screen now, you see the dates of these conferences. November 23 for the Northern Hub, November 25, Southern Hub, then Western Hub on November 30th, and the Eastern Hub on December 1st. Communications strategy, where you can find us. You see our email, you see our telephone number. Very soon we will launch our website, htf.org.ua, where you will soon find all the monitoring panels as to the community's participation in the healthcare decentralization reform. We invite you also to follow us on Facebook and Facebook group Vlasnik Medzakladu. And the most important, the online platform is integrated for the events of healthcare transformation reform. You have to register on the platform, and then using your profile, you will be able to participate in all the events and continue communication on the platform with all its participants, creating your own charts, your video rooms, and directly communicating with experts. This is one of the most important elements for successful implementation of the project. Please register, it's easy. You will get into the virtual environment full of many informational opportunities, and having attended this event at least once, you will get a good experience and will see that it's really easy. Dear colleagues, I would stop at this moment. We have now not more than 10 minutes, and I give the floor to Svetlana Bubenchikova. And now we will have Q&A session.
Thank you very much. We have some time for questions. Please speak louder because we cannot hear you. The sound is really bad. I will try to speak louder. Can you hear me? Yes, it's better. Okay. I would like to invite you to Q&A session. So our experts presented the information, and now I'd like to invite Kaderova. I have a question for the participants and the audience. Could have more information about the roles of the experts of the project. I would like to ask you, starting 2015 till 2017, local self-government bodies in the region, they needed more to launch the reform. Now we are at the new stage. The hospitals were provided that were previously in the ownership of regional councils. In connection with this, there is a discussion concerning reduction of the network of medical institutions. For our citizens, in communities, hospitals, they are not just places for medical help. They also are city and town organizing institutions. So the question is, what will happen if the situation would require closure of some hospitals? Now there is a lot of chaos, and how decisions should be made, how in communities and in the country on the whole we should deal with these issues. Good afternoon, dear colleagues. Good afternoon, dear participants of this press conference. I'm glad that today we launched this project, and the important issue is the issue what to do if a hospital is inefficient and it doesn't work properly. And on Facebook there are many questions. This is SOS questions. People, they are fired, they don't know what to do, and the people suffer because of this. Starting 2015, I was the advisor of the Ministry of Healthcare of Ukraine, and at that time, these issues appeared concerning decentralization. And due to my deep knowledge of this issue in other countries, we tried to find the balance concerning decentralization and the provision of medical assistance. The most important question that you've mentioned, Svetlana, healthcare organizations in the territory of the communities. This is not just a place where medical services are provided. These are also working places for medical workers, for doctors, for nurses, for some different people, for some staff. And these institutions are also important as social and cultural institutions, and there is auxiliary infrastructure, and this is also working places, transport, communications, and other things that accompany the processes of provision of medical assistance. And for communities, this is a critically important question to preserve these working places. But if the hospital is inefficient, it's not reasonable to keep it. And Yevgeny has shown us today that we will have a particular approach to each hospital, to each component of the network. We will have an individual approach, taking into account the needs of population, because the members of communities, they have the right and they should be able to realize their right to get this medical help close to the place where they live. All these services should be organized in such a way not to harm the budget of the families, because as Yevgeny outlined it clearly, that all the risks are brought from the hospital to families, to households. So these are transport expenses, payment for additional laboratory services, and other services. That's why I believe that those models we analyzed, and during the conference we will provide several cases to show how to work with this. That's why I believe that in each separate case there will be individual solution That's why we invite all communities to online conferences that Yevgeny mentioned, and we will be will be able to provide more information on this issue, and all the processes that will be proposed, they will be proposed in the framework of the common concept of the healthcare reform, financing of healthcare, and what we face now. Small hospitals and rural hospitals in different countries, they face the same problems. That's why we should find common solutions. So we should understand the situation in each community and the need of the communities, and they should provide proper care to those who live in these communities. And we have Incideris, the international expert on transformation of healthcare. Good afternoon. Now we are undergoing that day that Lithuania has already passed, and we have been speaking with you before, and you attended the forums, and we were discussing the steps that were made, and now we face the same problems in Ukraine with healthcare reform. We would like to know your opinion. What model of work and interaction between the government bodies and the management of hospitals, what model is the best and vital for Ukraine? Or maybe you would propose some interesting ideas for us concerning this. Thank you very much for invitation to this press conference. First of all, I would like to say that Ukraine managed to see our experience that we have. We had 4 stages of restructuring, and this year we start the 5th stage of restructuring. We carried out decentralization in 2000. The hospitals were transferred from central level to the regions. First, we had some districts. We provided the hospitals to the districts. And then there was a decentralization in the regions. So what I would like to say, what mistake we've made, I believe that now we have difficulties in correcting this mistake, and the international experts, they also have shown to us that first you should identify what services are needed, the number of services, and how they will provide for each region and each rayon, and to make this reduction of services or to take decisions to close or not to close some hospitals, to reduce the number of services and volume of work, and only after this is done, then to transfer these hospitals with limited services to local self-government. What happened here? What problem we have? Without restructuring, we provided these non-prepared hospitals. We provided them to the regions, to the rayons, and local power. They bring political responsibility. They started fighting for survival. During reform of healthcare, sometimes we should deal with issues like in oncology treatment. We should think through, and then we should cut deep without these half solutions, because when we transferred the hospitals and started to take away some services, some surgeries, some other services. We have now small hospitals. For them, it is difficult to survive. They balance at the brink of bankruptcy. And we should deal something with them. We should do something with them. But for local self-government, this is a political decision. That's why you should avoid the situation in Ukraine. Lithuania is small compared to Ukraine. We have 60 regional hospitals, and out of them, we have 12 small hospitals that are now in big financial minus. And we cannot attach them to other institutions, and we cannot close them. So we wish that in Ukraine you would be able to avoid the situation. Thank you very much. We hope for this, and we would like to calculate and to agree properly to build cooperation, efficient cooperation between communities. I would like to give the floor. Vladimir Rybchuk, are you with us? Good afternoon. Good afternoon, Vladimir. Now we are going to speak about cooperation between communities, and you are one of the authors of the manual on cooperation between the communities. So I would like to ask you, what is your opinion? What are the key factors for successful implementation of contracts of intermunicipal cooperation? Please tell us. Thank you. Thank you, Svetlana. First of all, greetings, dear colleagues, dear friends who I see in this project, and they are participants, experts, organizers, and those who I see as participants of this online event about this issue. This is short but really complicated. When we are speaking about intermunicipal cooperation as an instrument to reach some goals, when we are speaking about healthcare and financing of local systems and networks, these are key things. This is the level of trust and transparency and the level of quality of dialogue. So we should start with this. We start systemic work, and based on these factors, we may start our systemic work to provide analysis, figures, and to share information on a constant basis and on expert basis. So these are the factors, speaking briefly, that may bring efficient intermunicipal cooperation when we are speaking about healthcare facilities and the indicators of their work. Yes, I agree with Vladimir about the quality of the dialogue. We were speaking about intermunicipal cooperation, and it is important in this process to establish proper cooperation between the owner and the manager of the institutions. Alexander Shapoval now is given the floor. Can you hear me? Please join us. Alexander, are you with us? Unfortunately, Alexander has some problems with his camera. Good afternoon. I cannot hear you. Alexander, please turn your mic on. Alexander was the deputy of the head of the regional administration. Now he is the head of the base Oleksii hospital, and he has experience of both sides of the process. concerning introduction of local programs of support, first at the level of the deputy head of the regional administration. And I remember his experience. He has a significant experience. That's why I invited him to join our project. And now he is the head of the hospital. And now they have different situation, and he is from the other side of the process. Thank you, Yevgeny. So I wanted to say these words as well. So Alexander, so we identified that you know the situation from the both sides. What is your opinion in relationship between the owner and the head of the institution? What is the basis for success if we are speaking about the direction of this institution, where it moves, how it should work in the network of the healthcare institutions, but in the context of this interaction between the manager of the institution and the owner of the institution? Can you hear me? Right. This is a pleasure to have this access to information from the first hands. For me, and I'm the head of the healthcare institution, for me this is really interesting. So in the context of cooperation, this is actually a difficult point when you understand as the head of the institution that you should reduce the number of services that you cannot provide at the high quality level, and the also there is a question of responsibility of the owner before the community. So everything will depend on the heads of medical institution, I believe, whether they be able to explain the situation in a correct way. Often I hear that the heads of institution, they complain of the owners of institution, but one expert said, so the heads of institutions, they should provide information properly. We should find common grounds, and the patient should be the main beneficiary, not the head of the institution and not the owner. And we have partner relations with the mayor. This process is not easy, and I understand that I should reduce some positions of doctors, gynecologists, and this is about 300,000 of over cost. So we should find some common ground to have compromise. We should take into account all the process. This is briefly from me. Thank you, Alexander. And we understand that figures, calculations are really important. We should base our activity on them, but we should have a common understanding to reach good results. And all stakeholders involved in the process should properly communicate. And dear participants, we cannot avoid this topic that I would like to mention. We won't go into detail, but we understand that this formation of the local network of healthcare institutions, here we need agreement between the heads of hospitals and also the system that will be built around this network. It is also important. So this is infrastructure, investment plans, and also plans to attract investment and to have this public-private partnership. These are deep issues. And today I may only ask some superficial questions on this topic. Elena Reshetnyak is given the floor. She is the expert of the project concerning investment issues. Elena, we have been speaking about the situation when in the community, in the amalgamated communities, decisions may be taken and issues may be raised about closure or reform of medical institutions. And in your opinion, do we need to attract investment? Whether it is feasible for the hospitals that may be closed. Good afternoon, thank you for giving me the floor. So, in order that our guests be able to properly understand us, I am going to speak in Russian for our international partners. So, the answer depends on the model that will be chosen. Today we heard about transitional institutions, transitional healthcare facilities, and we heard about the options of this transition. So here the question is for communities that they, together with it's difficult for me to speak Russian. We need to find common answer what choice we will make and what we need, and the scope of investment will depend on this. We need figures, information, and a clear understanding of the options we have based on the international experience. So the project helps to make these calculations, to go through the stage of choice. The choice is yours, but you should understand the options. You should manage efficiently. This means you should consider options and to choose properly. So we need grants, we need mechanisms of public-private partnership, and this all will allow us to find answers to the questions. So we should understand what road we are going to move, and it was stressed before what need we have in healthcare services, what potential the institution has, what they have around them, and with whom they should agree, and how to make the right choice. And I'm glad to be a part of this project. Thank you. Thank you, Yelena. And with your help, we'll be able to identify the need in investment, to develop this network in the communities, and with the help of the next expert, and I would like to give the floor to Oleksii Zhazhevets, and he is our legal partner. He provides legal support of the project, and also he deals with the formation of the contracts concerning public-private partnership, and so I now would like to ask you, do we have regulatory mechanisms of involvement of investment by the territorial communities, including this private-public partnership? Please speak briefly. We do not have time to go in depth. Thank you. You give the floor. Good afternoon, dear colleagues. Brief answer, yes, we have mechanisms. The other question, they are really complicated at the moment. They do not take completely into account all specificity of these projects in healthcare sector. So what about positive examples? We do not have them in Ukraine. No, maybe there are several of them in Ukraine. 1, 2, or 3. But we have such mechanisms, and we should use them. And there is a trend to improve these mechanisms. There are legislative initiatives, and we hope that they will find support, and this will simplify the matters in the healthcare sector. These mechanisms of private-public partnership will work, and let's move forward. Let's get down to our work. Thank you, Oleksii. Thank you, dear colleagues. I give the floor once again to Yevhen. for final remarks of our event. Dear colleagues, thank you very much for your participation. Thank you, dear audience, that you spent these 1.5 hours with us. And we wanted to have a press conference, but it actually resulted to the scientific conference. So we understand that these tasks, these challenges that we face, they are really big and serious, and we should consolidate our efforts to resolve these issues. And that's what we are going to have during these 8 or 9 months, and we will show good results. Once again, I would like to say that we carried out serious work in order to have this project, to start this project, and now we want to have next events and to speak with our colleagues from the communities. They should be involved in this process, and this is a difficult job. So we will try to involve experts. We will try to support all communities who will be with us in this journey to bring them to the good final result. And for us, it is really important to have good results, not only on paper. Yes, we may provide the recommendations, we will calculate everything, we will make forecasts. I am convinced in this. But these decisions should be implemented. One of the criteria and one of the wish to communities to be strong, to be really self-efficient, we need proper results, because those cases that will be in the framework of this project, they will be scaled up for the whole country, and we should show positive result in practice. Thank you, dear colleagues. Thank you for being with us today. Ahead, we have big work, I would like to stress it, and we will do it together. And may I say, this is Igor, yes, thank you. And will we include the Ministry of Healthcare, the Healthcare Center, and also the healthcare institutions? So we studied the experience of Lithuania and this reformed structure, and we cut some things, we reduced the number of surgeons, but we need to have these surgeons in the system. And the ministry, the committee of the Verkhovna Rada on Healthcare and the Healthcare Center of Ukraine, they should be with us in this project. We should be able in 2022 to have some changes for 2023 to provide the changes to the budget to deal with these issues. This is from the communities. So, as you may know, we communicate the sectoral ministries with the Ministry of the Regions, and from time to time in the framework of our project, we will have separate consultations. And yesterday, during the consultation with the Ministry of Healthcare, we discussed this issue concerning the involvement and trilateral and quadrilateral consultations in the project with the Ministry of the Regions included. So, about the Committee of the Verkhovna Rada on Healthcare, we have some communication with them, and we will have some meetings with them, and if they have this wish, they will join our meetings in the project to communicate with us about the National Healthcare Service. At the moment, we consider them as our partners, and at some stage now the program of medical guarantees is being formed for 2022, then it will be formed for 2023. When we are speaking about the format of the new hospitals, they developed the package concerning surgery. We do not know what tariffs will be, and we have communications with them. They will be on a continuous basis, otherwise we won't be able to produce efficient results. So this is a consolidated effort between experts, national and international partners, and the bodies who are responsible for the transformation of healthcare system. Your advice, your experience of communication is also needed. The Association of the Communities is really important organization, and joint events with our project and with your initiatives, we will coordinate our efforts. Thank you. I would like to ask all the speakers who do not have their cameras on, please turn on your cameras in order that we would be able to make a photo to provide them to the materials of our conference. Please, if you hear us, please turn on camera. Alexandra, please, in order to make a joint photo. Thank you. So what motto would we have? In any case, let's smile. Thank you, this is wonderful. Thank you very much, dear friends. Till the next time, we will meet during the next conference. This will be integration conference. We will meet each other. We will get acquainted with the project, with our target audience, and during 3 or 4 hours we will be able to work together to communicate efficiently. Starting 22nd till the 1st of December, we will have 4 integration conferences, and they will have the same speakers, but they will be oriented on the 4 hubs that were identified in Ukraine. If you have such an opportunity, please join us, and please join the hub and the part that is mentioned for you, but you may participate in all 4 events. This is allowed. Till the next time, thank you very much, dear colleagues. Goodbye. Thank you.
Рада была видеть всех.
It was a pleasure to see you all. We will have a meeting with Yevgeny and with all the experts. So we've met virtually, maybe we met face-to-face, and we should identify the context concerning presentations and the conference. So Yevgeny and Svetlana, we will communicate further on. Yes, we are on the